We're pretty much just going to focus on chapter 1 of the open stacks. We're going to look at just the basics right away of defining anatomy and physiology. We're going to talk about the orders of complexity of life. We're going to start at the kind of the smallest or most micro level and look at the levels of organization all the way up to the organism level. We'll talk about anatomical position a little bit, and then we'll get into most of the time spent on more directional terminology, as well as some of the other body region terminology. So right off the bat, we look at anatomy and physiology. We need to define it or describe it. When we look at the term anatomy, we generally are thinking of the study of structure. Okay, when we look at physiology, we're looking at the study of function. So anatomy, again, focuses on what is it? What structure is this? Now, as you see in the slide, we've got gross anatomy and microscopic anatomy listed there. Gross anatomy is the focus, is going to be on big or large scale. What we would maybe the opposite of micro is macro, M-A-C-R-O. So macro scale or large scale anatomy would be considered gross anatomy. Looking at an X-ray or an MRI, that's considered gross anatomy because those images are showing us large structures that we can see with the naked eye. Okay, when I'm looking at tissue samples or cells, I need a microscope for that. So we call that microscopic anatomy. So tissues have their own type and have specialized structures. Cells are specialized and have specific structures. We call that microanatomy. Okay, or microscopic anatomy. So we're going to focus on all three. We're going to look at cell anatomy, we'll look at tissue anatomy, and then we'll certainly look at organ or gross anatomy, okay, or macro scale. Those two terms that you see at the bottom there, cytology and histology. Cytology, well, first of all, we see L-O-G-Y at the end. These, of course, mean the study of. So whenever we see a term with logi or og at the end, it just means the study of something. CYTO is the combining form for the word cell. So whenever you see cyte, CYT or CYTE or CYTO, anything with CYT in it always means we're talking about a cell. Okay. Histo relates to tissues. So when we look at histology, we're looking at the study of tissues. And we'll talk more about what that means in just a second. So I will say, though, that tissues and histology are under the micro scale. Okay. Most of the terms, in fact, probably 95% of the terms that we deal with in medicine are going to be related to either Latin or Greek. If any of you have Spanish background, some of this terminology is going to make a lot of sense because it's Latin based. Spanish is Latin based, French is Latin based, and there are a few other languages certainly around the world that are based on Latin. And then, of course, Greek is, there's people from Greece speak Greek, certainly. And then, but most of this comes from ancient Greek, which is slightly different. But regardless, the terminology that we're learning this semester is not just, you're not just learning a foreign language, you're learning a couple of foreign languages. You can watch the terminology video. It goes through some of the, I believe it's the same one that's in your, that's in your course shell. But anyway, another way to access it. Also, too, I looked up, I typed in medical terminology in my, I don't have an iPhone. I have an iPad tablet, but I have just an LG smartphone. And so I have Google Play, and I went into Google Play, and I'm sure you can find these in the Apple Store too, but I typed in medical terminology to see if there were any good apps. And there weren't a heck of a lot that popped up. The ones that did pop up were very basic, which sometimes is good, where you just simply have it has you click on prefix, suffix, or the root, and then you can search um, any prefix or suffix. So anyway, there are apps for learning medical terminology. Some are pronunciation apps too. So they'll talk to you, you talk back to them. So if you're struggling a little bit with some of the terminology, you may want to check into that. Let's move forward, though. Levels of organization. This is kind of the bread and butter of what we're going to be doing this entire semester, and that's analyzing the different levels of organization, and specifically taking each body system and breaking down the organs in those systems and analyzing what the structures are, what they're made of. The smallest level of organization that we're going to deal with is what we call the chemical level or the molecular level. Um, this happens to be kind of the progression of the semester too. The chemical level or the molecular level. This is where we start next week. Okay, and then week 3 we'll get into the cellular level. Week 4, we'll talk about tissues, and then we'll start our first system, which will be the skin. And then from there, everything we do will be focused on organs and organ systems. So the first couple of weeks of A&P generally are the rockiest for students because of the terminology and because of the micro aspects of what we're doing. So this is a couple of weeks of looking at things from a micro perspective. Now, that doesn't mean that after the first couple of weeks, you're never going to see anything again relating to micro scale anatomy. If you're having issues with some of the terminology and grasping some of these items after the first couple of weeks, don't worry, because every week, whenever we start a new body system, we go back and look at the cellular aspects, we look at the tissue aspects. So again, you're going to hear the same terminology on the micro scale and the macro scale throughout. So by the time you get to advanced A&P, when you hear the word mitochondria, when you hear the word cell membrane, when you hear about proteins, when you hear about cellular respiration, these terms right now could be putting you into a complete panic mode. I hope they're not. I don't want to be triggering anything. But the idea is, after several weeks of seeing and hearing this and putting these pieces together, it's going to become just part of your normal lingo. It's going to become part of what is just etched into your brain. Believe me, 12, 13, 14 weeks from now, you're going to be blown away at the amount of new information that you've attained this semester. So don't get frustrated. You're building a gigantic puzzle with all pieces being interlinked. So we started at some of the tougher stuff, unfortunately, but that's just the way it goes. We do start at the chemical level. Know that next week I'm not going to be focused on really deep, intense chemistry. I'm going to be focused on carbon, hydrogen, nitrogen, and oxygen. I'm going to be focused on 4 main elements for the most part, and that's it. I think you've all heard of those things. From all things that we do, all compounds and all of these macromolecules that we look at, almost everything comes back to those 4: carbon, hydrogen, nitrogen, and oxygen. Okay, like water is hydrogen and oxygen. Okay, sugar, all the sugars you eat, whether it's a starch and a complex carb, whether it's a spritz of honey, an apple, whatever the sugar, or candy, ooh yeah, gummy bears and peanut M&Ms, and ooh yeah, yum. So that type of stuff, those sugars too, those are carbon, hydrogen, and oxygen, CH and O. And then proteins are also CH and O, and then they have nitrogen as well. You've maybe heard of amino acids. That's part of, those are the building blocks of proteins. And then fats, the other one we look at, those have carbon, hydrogen, and oxygen as well. So the chemistry we do is going to be very relatable to your understanding of homeostasis and your understanding of the basics of human biology. We're not going to get too deep into chemical reactions and synthesis this semester. We're going to do that next semester. But I will introduce you to some of the basics regarding the chemistry terminology. We'll also look a little bit at a couple other elements on the periodic table besides those four I just mentioned, C, H, O, and N. We're also going to look a little bit at magnesium and sodium and potassium, um, calcium, and that may be about it. We don't maybe phosphorus too. So we don't spend a lot of time on a massive amount of chemistry. We spend the time we do spend is valuable in the way that the 4 or 5 things that we focus on, you will see and hear and understand really throughout your entire experience in A&P. So don't sweat the chemistry. It's not going to be that bad. And then after we do chemistry, we're going to do a little bit with cells in week 3, and we're going to look at the organelles. The organelles are tiny structures of cells that are going to participate in a lot of the functional aspects of what the cells are doing. Okay, so we're going to look at cells and some of their parts. Okay, and then after that, we're going to go for a little bit further, and we're going to put all of these cells together, and we're going to make what are called tissues. So a tissue is a bunch of cells put together, and again, these are all going to be specialized. The cells of the heart are going to be different than the cells of the liver, for instance. So the tissue is going to look slightly different between the heart versus the lungs, or the heart versus the liver. So cells are specialized, the tissue is going to be specialized. And then at that point, when we leave the tissue level, we get to the organ level. Now we're into the macro scale or the big scale. Organs are visible with the eyes. We don't need any special tools to see them. So we're going to be dealing with the gross anatomy or the macro anatomy at that point. One thing too I wanted to mention really briefly on the clinical scale regarding tissues. All of you have probably heard of a biopsy along the lines, and a biopsy is a tissue sample from a specific organ. So if I need to see whether or not there may be some cancer going on of the lung, I'm not going to have to remove the entire lung, the entire organ, to see whether or not it's cancerous. But I can take a small chunk of the organ, which would be what we call the tissue, and that chunk of tissue is going to be filled with cells. And so when we take that tissue sample, we're going to look under the microscope and we're going to analyze the cell structures of that tissue sample. And we know what normal lung cells look like under the microscope. We know what abnormal lung cells look like under the microscope. So based on certain types of abnormalities, we may be able to determine, we can even just look at numbers. Sometimes it's simply, we know how not only the structures of these cells under normal and abnormal conditions, but we also know the numbers. So if there are way too many packed in, and the ones that are there are very shriveled up, they're tiny, but there are a ton of them, that could be a bad sign. Cancer is a cellular issue. Okay, it's not a problem with the organ. The organ has problems because the cells that make up the organ are the problem. Okay, So all pathology that we look at, all of the chemistry that we look at, and making sure that the pharmacology is in order, or the biochemistry is in order, all of that is to ensure that the cells are being fed and the cells are being cleaned. Okay, we have to get groceries to the cells, but we also have to take the garbage away from the cells. And when too much of certain types of garbage or toxins build up in the cellular level, that can lead to excess carbon dioxide buildup. That can lead to all kinds of issues regarding pH balance. And then next thing you know, cells are mutating and going through apoptosis and mitosis problems. So we're going to look at that in a little more detail here in a couple of weeks. But I do want to, again, remind you that chemicals, cells, and tissues all make up organs. And when we talk about the health of an individual and the health of an individual's specific organ, we're really talking about the health of the cells of the individual's organ. So anyhow, all roads lead back to the cells and to the chemistry of those cells. So anyway, we leave tissue level, and then we get into the organs, and then the organ systems, and then finally the organism. So when we look at this illustration, we can see again, we start up at this atomic level. We've got our subatomic particles, your protons and neutrons, and then your electrons out here. And then we start working our way into the chemical level. We put some of these together and we get a molecule. Put some molecules together, we get some compounds, and next thing you know, we're dealing with little tiny organelles of the cells that are going to be able to work with and manage some of those molecules or manage that chemistry. And then, okay, so this is the cellular level, the organelles and the cells together. Then we put all these cells together that again are going to be like cells or similar cells in structure and function. And now we have a tissue. This happens to be nervous system tissue. And then we put all that nervous system tissue together and we end up with a brain or a spinal cord or nerves. And then we put some of those different organs together and we end up with an organ system. So we can see the nervous system who's going to have the brain, spinal cord, and nerves. And then we have several other body systems. And again, this is basically how we approach this semester. We're going to study the chemistry next week, the cells a couple weeks later, and then the tissues, and then we're going to start going organ system by organ system. Actually, we start up here, integumentary on down the line. Okay. So these next few slides, I'm going to zip through them relatively quickly. They generally just go through what I just got done talking about. So this is kind of the black and white of it. So again, you do have access to all of these slides. So the chemical level of organization, again, we're going to look at next week, chapter 2. And then we get into the organelle and cellular level, a couple of terms that we see when we're talking about organelles. Again, big words for now. I don't need you to worry about these at the moment. I need you to worry about these in a couple of weeks when we get to cellular level. And again, all of these organelles are specialized depending on what type of function we need we need those cells to perform, and ultimately that we need the organ to perform. And again, organ systems, that's how we approach the study of A&P, system by system. And everything put together gives us an organism. Next up, we get into some specifics regarding anatomical terminology. The first thing we analyze is the correct anatomical position. This is simply a reference tool when we look at and refer to anything in the charting. We're referring to everything as it would be in correct anatomical position. Okay, so what we have, and again, this is a reference point tool. This isn't how we're supposed to stand or walk around. It's again simply for reference. One thing we notice is we have what's called the midline. I mentioned mid-sagittal a little bit ago on that question 15 about the stab victim, but we see this is called the mid-sagittal line or the midline, and that's going to divide us into left and right halves. And this left and right, these left and right halves make us bilaterally symmetrical. Now, that symmetry doesn't, so basically it just means we're mirror images for the most part. We have a left side and a right side, and one of each thing on each side, except internally that doesn't hold true with the viscera necessarily. The left lung, even right down to the left lung and the right lung, are slightly different in size and scope. So generally we think of the symmetry being related to more of the external features, as well as like the musculoskeletal system. Bones and muscles are going to be symmetrical. If you have one bicep, you're going to have another one. Okay, so typically we have left side, right side for that. Okay, a couple of anatomical terms. Let me get this moved over a little bit. Okay. All right, so some directional terms, and again, this is just your introduction. You're going to see these terms throughout the semester and really throughout your lives as you're entering into the medical field. Superior and inferior, dealing with top and bottom. Anterior and posterior, having to do with in front of and in back of. Okay, and then we've got medial and lateral, dealing with toward the middle and away from the middle. Now, we also, when we look at anterior and posterior, you're going to see, especially in visible body, they use terms like ventral and dorsal as well. And those are applicable too. Ventral, it has to do with being in the front. So you could consider anterior and ventral to be synonymous, or to basically be the same thing. Dorsal and posterior are also the same thing. They mean in back of or toward the back. So keep that in mind too. As you're working on those visible bodies, you're going to see dorsal and ventral and go, what the heck? I don't remember. So anyway, put that with anterior and posterior, okay? Dorsal and ventral. Top and bottom for superior and inferior, and then again, medial and lateral, toward that midline that we looked at a few minutes ago, and then away from the midline for lateral. Proximal and distal, we see these relating to being close to something and further away from something. Generally, we only use proximal and distal with the arms as we're referring to something from the shoulder out to the fingertips. We also see it when we're referring to something on the legs, comparing items on the legs, starting at the hip and going down to the toes. So, for example, we would say the shoulder, and has to do with the connection point. So, when we look at this illustration, we see proximal pointing toward the shoulder and distal pointing down toward the fingertips. So if we were going to compare structural aspects of the arm, we would say, for example, the shoulder is proximal to the elbow. Okay. Could also say the elbow is distal to the shoulder, simply meaning the elbow is further away from the attachment of the arm than the shoulder is. Okay. So we said the same two things, shoulder and elbow, but depending on what order and how you're referring to them, if you're referring the shoulder is what to the elbow, we would say the shoulder is proximal to the elbow. If we're saying the elbow is what to the shoulder, we would say the elbow is distal to the shoulder. Just means the elbow is further away from the shoulder. The fingers would always be distal. So if you're saying the fingers are, you can just put distal no matter what. The fingers are most distal. So the fingers are distal to the hand, they're distal to the wrist, they're distal to the elbow, and so on. The shoulder is always going to be proximal. So the shoulder is right away, it's proximal, no matter what we're talking about. The shoulder is proximal to everything else. Now, if we're talking about the wrist versus the elbow, we could say the wrist is distal to the elbow. That just means the wrist is further from the shoulder than the elbow is. Okay, we can reverse it and say the elbow is what to the wrist? We would say the elbow is proximal to the wrist. It just means the elbow is closer to the shoulder than the wrist is. So as you're doing your physio or your visible body labs, like I approach the even now, like I've been doing A&P since 1992 as a student, and then as a professor since 2000, and I still read. When I read case studies or read like that number 15 that we just looked at regarding the stab wound, when I see the word posterior, I'm still reading back in my brain. Okay. When I see the word proximal, I'm still seeing closer to the shoulder or closer to something. When I see the word anterior, I'm reading in front of something. So that's basically how you'll approach these. So when you're reading these questions, just read them. When it says posterior, just read it as in back of. So it's saying that the wound is in the back, and it's in the mid-sagittal line, or it's on the mid-sagittal plane. You see mid-sagittal, you're thinking, oh, it's right down the middle. It even has mid in it, just like middle does. So posterior mid-sagittal, you're just thinking, you're reading it as, oh, this is in the back, and it's right along the middle. And it says the word thorax in there. I know that means kind of the middle back. So somewhere in the middle of its back, right along the middle. So again, as you're reading through and answering your questions within your visible bodies and your portfolios, you're just kind of translating and going about reading the questions in that manner and answering the questions in that manner. Okay, a couple of other things. We've got body planes here as well. A plane is simply a kind of an imaginary dividing wall or dividing marker of some sort. We generally see these when we're talking about viewing images like an MRI or a CAT scan. Or an X-ray, illustrations that we're going to see within our textbook, and within some of our slides and some of your homework. Those are going to be in different sections, different viewpoints, in essence. So if you're looking at something head on or from the front, if we've sliced something and it's separating the front from the back, we call that the frontal plane. If we slice something and we're looking at something from the side, we call that a sagittal plane or a sagittal view. If we're looking at something from a bird's eye view, or we're looking up through something, like you would see a lot of MRI images are going to be, so here's like an MRI image. These are going to be transverse cuts or transverse planes. You may also see that as a cross section. Okay, so those are the different planes. A couple other terms too that we do see throughout all of these so terms related to organs. So now we're moving away from cells and tissues, and now we're into the organs. We see organs are either hollow or they're solid. A lot of the digestive tract is going to be hollow. If you hear the word tract, T-R-A-C-T, not T-R-A-C-K, not a track, but a tract with a T. That's an indicator. So respiratory tract, urinary tract, digestive tract, Reproductive tract. If you hear the word tract, that's indicative of we're probably dealing with tubes, okay? Tubes or hoses. Okay. The lumen is the opening, or kind of the hollow area of the tube. It's the area that food, for instance, would be passing through. That's the lumen. Okay. The hollow area, okay, of a tube. And then we see central and peripheral. Those are similar to, that just means we're talking about toward the center, peripheral away from the center, away from the boundary. We'll see this with the nervous system, the central and peripheral nervous system regarding the brain and spinal cord, and then the nerves. Medullary and cortical, we see those when we're dealing with a solid organ. So the kidneys are a solid organ, or the pancreas, or the liver, or the adrenal glands, the heart. These are all solid organs. Okay. The outer layer is called the cortical region. So kind of viewing it as almost like an orange, for instance. The orange peel would be the outer layer of the organ, whereas the flesh or the meat inside of the orange is going to be considered the medullary, or the medulla portion of the organ. So like the adrenal glands, the outer layer is called the cortex. That's where cortisol comes from, which is an anti-inflammatory. You've probably all heard of cortisol or cortisone. Your body produces cortisol and releases it from the cortical region of the adrenal glands. Okay, then basal and apical, this deals with kind of like a pyramidal shaped organ. The basal part would be the broad portion. The apical part would be the narrow portion. So like the heart is shaped kind of like an upside down, I don't know if I can even do it, kind of like an upside down pyramid. So the apex of the heart would be down here, and then the base of the heart would be at the top. So my point is the basal, or the apical, they don't have to be bottom top per se. Basal just means it's the base, or the broadest portion. The apical is the apex, or the peak, or the narrowest portion. Again, that can be inverted, which we do see with the heart. So I just keep that in mind. This slide, more or less, this FYI. I'm not. It's. Let me go for it. You're going to see in some of the images and illustrations that I have throughout my slides this semester are going to have a little compass, and this little compass is going to help orient, just like a regular compass, right? It helps to orient you if you're north, south, east, or west. So that's really what these do, but instead of north, south, east, and west, it's going to use A's and P's. So like anterior versus posterior, right versus left. So when we look at this transverse section of the abdomen, if we didn't have this compass, it may seem a little bit tricky trying to determine if I look, what direction am I even looking at here. So we know the liver is always, the bulk of the liver is on the right side. So we're going to safely assume that this is probably the right side. But since I have my compass, I can validate it by saying, oh yeah, there it is. It's got an R. That's the right side. The other thing I see is a vertebra here, and vertebral foramen. This would be where the spinal cord goes. So I could probably assume that this is the little spinous process right here. So when I palpate or run down the back or the spine, you feel a little bump along the way, right? That's what this little bony protrusion is right there. That's one of those little bumps that you feel down the center, or the mid-sagittal or the midline of the spine. So I could probably assume this is the back, or the posterior version. So again, we can come over and check just to make sure, and sure enough, this is the posterior. So this is going to be toward the belly, or toward the front. This is going to be toward his back. And again, this view, notice, is a slice, a transverse slice, or transverse section. When you go into the MRI tube, those are the images really that we're taking, are in this kind of transverse section. Okay, a couple more things, and then we'll wrap it up. We have what are called body cavities. Your body cavities are going to be or either dorsal or ventral. I almost said anterior, posterior, but so there you go. Dorsal and posterior, meaning the same thing. Your dorsal cavities are going to contain the brain and spinal cord. We call those the cranial and spinal cavities. A cavity is kind of like a room, basically. Like our word cave comes from the word cavity, or the word cavern comes from cavity. But the cavity is going to be a protective area to contain these organs. So the brain and spinal cord need to be protected. We can't have the brain sitting inside of the skull and it being right up against the skull bone. So we do have some space between the skull and the brain. So the brain is basically floating in liquid contained within these cavities. A concussion occurs when the brain passes through and makes contact with the inner aspect of the skull. So the brain, like I said, it's kind of floating in a cavity. You can kind of see this up here. There's some space between the brain itself and then this outer layer. So that would be like the cranial cavity. And if that brain does make contact with the inner part of the skull, that's again what we would call a concussion, and there are different degrees of that. But anyhow, in the spinal cord, the brain and spinal cord are all one unit. And the brain and the cranial cavity and spinal cavity are all one cavity. But anyway, because the spinal cavity is so small and the cranial cavity is so big, they do distinguish the two of them. So you can see a good illustration here that really the brain and spinal cord are all one. It's like a flower, right? It's like the stem of the flower, and then the flower itself. Okay. And the brain and spinal cord cavities, or the cranial and spinal cavities, have a triple layer of protective membranes. So all cavities are going to be lined with membranes. These particular dorsal cavities of the cranium and spinal, they're going to have three layers. Now, these layers are called meninges, and I think all of you have probably heard of meningitis at some point. So meninges are the triple layers that line the cranial and spinal cavities. We'll look at them in a lot more detail here in several weeks. Let's see. Oh, and then we have the ventral cavities. We've got the thoracic cavity. This is the thoracic region. And then we've got the diaphragm that's going to separate the thoracic cavity from the abdominal and pelvic cavities. So notice the diaphragm is one complete wall that separates the thorax from the rest of the abdomen. We also have the heart located within the thoracic cavity, and specifically, we've got a little region called the mediastinum, and that's going to be where we're going to find the pericardium of the heart. We'll also see the trachea and the esophagus all kind of travel down through that mediastinum. So anyway, those are the body cavities. We'll see them again. I just kind of introducing you to these items. A couple other things, and again, you'll be doing these in your visible body and your portfolio exercises and activities. We have abdominopelvic quadrants and abdominopelvic regions. Again, we use these in a clinical setting for charting. We have we use the belly button as kind of the axis point there, or the intersection point, and we see the right upper quadrant, left upper quadrant, and those can be abbreviated RUQ and LUQ. And then we have the right lower quadrant and the left lower quadrant. Again, we can abbreviate both. Now, a clinical relevance, we want to know we want you guys to want to know over time what organs we would find primarily in the right upper quadrant. So you can see the bulk of the liver is going to be in there. We've got part of the colon. We definitely are going to find the gallbladder nestled in there. So if a patient presents right upper quadrant pain that kind of radiates, we're going to chart that, that we're going to abbreviate everything. You're going to learn clinical shorthand. PXRUQ simply just means pain in the right upper quadrant. So pain in the right upper quadrant is a lot to write down. PXRUQ is 5 letters, saying the exact same thing that 30 letters say. And so that could be indicative to the physician that maybe we've got a gallbladder issue, maybe we've got a pancreatic issue. Some pancreatic issues radiate over into that right upper quadrant. We see liver hepatitis issues refer certainly into that right upper quadrant. So anyhow, left upper quadrant, you're going to find the spleen sitting over there, and certainly a big part of the stomach. Uh, Now, this is abdominal pelvic, so it doesn't include the heart. But the heart, notice, is a little bit left justified. It sits up here. The diaphragm sits here. If we have some acid indigestion coming from the stomach, we might have a little bit of heartburn and that the acid reflux or GERD that could cause some left upper quadrant pain a little bit. Again, if we've got some bruising or some sensitivity in that left upper quadrant, it could be indicative of a spleen that's ruptured. We also see in that left upper quadrant, kind of where the rib cage ends. That's where we're going to see the large. By the way, these big this big long worm right here is the colon or the large intestine, and fecal matter is going to travel from the right lower quadrant up to the right upper quadrant, and then it's going to come across to the left upper quadrant, and then kind of head down and then out into the toilet. So there's a big kind of curve right in here. So sometimes patients may have some severe constipation. They may have some diverticulitis or diverticulosis, some sort of infection maybe in the colon or the large intestine that is also referring its pain into that LUQ area. And then this RLQ, or right lower quadrant, is where kind of the small intestines, which are these smaller worms, they're going to kind of dump waste into the colon or the large intestine over in this area. And right, one of the things we see over here is also the appendix. So if a patient is presenting some extreme pain and sensitivities and that in this area, it could be indicative of an appendix attack. Both of the ovaries and then some of the ligaments that suspend the testes are also located in these areas. So we could have some issues, ovarian cysts or a hernia or something along those lines. We could also have pain that, again, it kind of travels across both regions. The urinary bladder is down in this area, so that could be indicative of a UTI or something. Okay, LLQ, moving over to that area, that's the end of the line for the colon. So again, if we have somebody that's got some, and it doesn't really show it, we'll see it later in the semester, but that descending colon comes down and it kind of makes like an S curve. They call it the sigmoid colon. So you got kind of a dipsy doodle right here, and that can sometimes cause a backup in traffic. You could get some fecal impaction that can lead to diverticulitis or some sort of E. coli issue, which can then lead to a UTI, believe it or not. So anyhow, some of this, when patients come in and they present different types of pain to us, we may be able to determine or at least narrow down where our focus is going to be. We want to determine, is this musculoskeletal? They could just, notice there's a lot of bone around here too. We could have some herniation of the low back or vertebrae. We could have some osteoporosis going on with the head and neck of the femur. We have any number of issues. We could have, like I say, a hernia. We could simply just have some pulled muscles, pulled abdominal muscles. Your abdominal muscles all come down the front here and kind of attach into this area. So my point is, this area and knowledge of what's going on can provide us with all kinds of stuff. Good. Well, I hope, I'm sure that well, thanks, Stephanie. I hope so too. I hope I put a smile and a little giggle on everybody's throughout these, because I know some of this stuff can get a little bit mundane. So yeah, so if you're following along and you're paying attention and you're on on the train, yeah, you're going to catch some things that come out here and there. So I appreciate that. So anyhow, yep. So left lower quadrant. Okay. All right. So knowing your areas, and again, why would you wouldn't know most of this yet? So, but you do know where you do know that we can use the belly button for quadrants, because again, all we see is the integumentary system, right? When we look at a patient, we can't see anything underneath, and diagnostics are extremely expensive, right? So depending on how the patient's going to pay today, you know, they may get a Band-Aid and an ibuprofen. Or if they've got the Platinum Premier package, they may have nothing but a little pulled muscle that just maybe needs some rest. But we're going to send them off for MRIs and CT scans and blood work and a urinalysis. And, so, they've racked up $10,000-$15,000 on their insurance because they have the Platinum package, when maybe they just needed a little bit of ice and a little bit of rest and maybe some ibuprofen. So anyway, that's neither here nor there. And by the way, too, I'm going to go to the next slide. Depending on the physician and the clinic you work for, this is the other coding that is used to describe different areas where procedures have been done or are going to be done, different areas where pains are located. So yeah, you can see that the tic-tac-toe board is a little bit more complex, certainly than the quadrant board. This is a lot easier. Look, RUQ, LUQ. It's maybe certainly it's less specific. However, a lot of billing and coding dictates everything that we do in the clinic. So including how we chart. So if the billing and coding people prefer this, then the physician is going to prefer this too. So we teach both of them. You should know both of them, simply because you just never know. Yeah, sure. Yeah, if things are in, one of the questions asked about something that may be in two quadrants, would that be correct? Oh, sure, absolutely. There are a few things that are absolutely not in two quadrants. So let me go back in there. So like the gallbladder is only in the RUQ. The appendix is only going to be in the RLQ. The spleen is only going to be in the LUQ. You can make, so you can see the liver traverses. The stomach primarily is LUQ, but we do see, this almost shows like the whole stomach in the left upper quadrant. I would say there's some parts of the stomach that do come certainly into the RUQ. So anyway, yeah, you can. The thing about medicine is that in a lot of ways, the absolutes are minimal. There aren't a lot of absolutes, but for the most, we can, for the most part, close to absolutely say that the gallbladder is going to be in the RUQ. But again, depending on the patient, how many of your patients look like this? How many of your patients' body types are this? Yeah, exactly. Very few. So, I mean, if you've got someone who's really petite and maybe obese, like, or you've got someone who's super tall and skinny, or or super tall, and I mean, there's so many different. We try to avoid absolutes, I guess, is my point. Um, Oh, so yeah, so let's move into the correct appendix. See, that's another one. That's why you can find the appendix in the hypogastric and the right iliac. Depends on the person. I had my appendix removed, and my appendix scar traverses both. I have a um, I have a transverse scar for my appendix. My dad had his at my I had mine removed in 1988. I was 13 years old, 3 days before Christmas. You know, eighth grade. It was the last night of school, or last day of school before Christmas break, eighth grade year. A big play, Christmas play that night. So spend the whole day at school rehearsing for the big play, and I was doubled over all morning. And finally that night took me to the doctor, and they said your appendix is about to rupture. So I went, they rushed me to the ER, and this was in Rockford. And then they sliced me open and took my appendix out. But anyway, it's a transverse scar. I got to go home on Christmas Eve, so they had me in and out in 2 days, so that wasn't too bad. So I think it was about 7 at night on Christmas Eve. I went home. I don't know when I got that year. I think I got an NES, maybe that would have been 1988. I think it was a Nintendo that year. And I was getting that regardless of the appendix. So I didn't do the appendicitis gig just to get the Nintendo, by the way. But anyhow, my dad had his appendix out in 1963, and his appendix scar is sagittals north south, and his is way over here in the right iliac area. So, and mine traverses this area right here. So again, yeah, absolutes are tough, right? In medicine, that's why this particular the regional one versus the quadrants is a little bit trickier for charting, certainly. But we do still use it. We do still see it. So know these terms. We know umbilical means belly button. Gastric always means stomach, and epi in the front as a prefix means upon something. So this means upon the stomach. Hypo means below, so below the stomach. This is also known as the pubic region. Iliac, those are the names of your hip bones. Yeah, your hips that you can palpate, those are called the iliac region, or the iliac portions of your hips. And then inguinal is kind of like this area. Inguinal is kind of like your leg pit, right? We've got the armpit, where the arm and shoulder all kind of meet the trunk, and then the leg pit is called the groin, but that's not sciencey enough, so we call it the inguinal region or inguinal region, depending on, tomato to tomato tomato, not tomato potato. But anyway, hypochondriac, lumbar or flank. Lumbar means low back as well, right? And then hypochondriac, chondro means cartilage. So whenever you see chondro, it means cartilage. Um, that area along the rib cage there, there, try to see, like right in that. It's probably easier to just do it on this guy. Right here, that's mostly cartilage. Again, one of the problems of not being in class is, I've got big skeletons and models, and so it's okay. We'll persevere. Like I said, Halloween's coming up, so get out to Dollar Tree, get to Dollar General, and pick yourself up an inexpensive skeleton. Okay, let's see. Let's move on from this slide. We're almost done. We're home stretching. Axial versus appendicular. So axial says head, neck, and torso. Absolutely. So we would think of the skull, the vertebral column, and the rib cage, or the thorax. That's going to be the axial portion of the body, or axial region, the axis. And then in fact, on this slide, you can't tell as well over here, but on this particular one on the right, you can see we've got kind of that nice kind of pastel lavender color there. That's going to be indicating the axial portion of the body. So we can see we've got the skull and facial bones. Okay. Then we've got the vertebral column there, and then the rib cage. Included in that is going to be the sternum too. If we come over here, and again, you can't distinguish the colors quite as well, but the thoracic cage or the rib cage, and then the vertebral column and the skull. That's going to be your axial aspect. And then your appendicular, you probably heard the word appendage at some point. So we would call those the arms and legs for sure. So you see the extremity, oh, whoops, there we go. You see the upper extremity and lower extremity. And then we've got the, you guys know it as your collarbone and your shoulder blade, or your patients will call it that. You'll learn it as the clavicle and the scapula. So your collarbone and shoulder blade, those are actually part of the appendages or the appendicular skeleton. Okay, and then same with the hips. We call this the pelvis or the pelvic girdle, or the hips, or they call them coxal region as well. So that area is also part of the appendicular skeleton or the appendicular region. So that's probably the one students sometimes early on, at least, are kind of tricky, is the shoulder blade and clavicles, and then the pelvic region, or the pelvic bones or hip bones. Those are part of the appendages or the appendicular skeleton. So if you just simply remember skull, vertebrae, ribs, then everything else is appendicular. Okay, so axial, the axis, skull, vertebrae, ribs. Okay, that's the axis upon which everything else kind of articulates on. Okay, so when we look at these sections, this again, you're going to see these both in your visible body kind of treasure hunt or whatever, and then your portfolio. So so refer back to this too if you need to. Refer to your slides. And again, you don't have to watch the video to see the slides, right? You know you can access the slides. Okay, good. Oh yeah, they see, they kind of show you here. They got the little violet and the cream color there for those. That's it. I'm gonna. How are we doing on time? Because oh man, almost like we know what we're doing. Okay. Next week, Tuesday, I'm going to start with homeostasis. I'm only going to spend a few minutes on it, but that's kind of going to be our segue between just this introductory chapter 1 stuff and then talking about chemistry. So we're going to talk about homeostasis next, just a few slides. They are in the week 1 slides, so you can go through. There's only a couple of them in there. Whew. There's only a couple of them in there, so of the homeostasis slides, but I'll leave them in here, but I'll also move them when I'm making week 2 slideshow. I'll move or copy these into there. So anyway, I do want to talk a little bit about homeostasis on Tuesday, and then I want to talk about chemistry, and that's pretty much it. And then on Thursday, we're going to go through and look at some of the chemistry stuff with visible body. We'll look at start looking at cells a little bit, and kind of transfer and segue into looking at cells. So other than that, I don't have anything else. Again, you want to do your Padlet. If you haven't already, you want to keep working on your portfolio and your visible body activities, and get those babies in the Dropbox, and then take your exam, and you should be good to go. And again, if you haven't done it already, you want to make sure you type your name into the thing. Yeah, Bina, a question for Lab 1 assignment. Let me, before you, or you can ask it, are you going to type it in, or are you going to come in and are you going to?
I'll come in and say it.
Hey, all right.
Okay. So I'm looking at number 19, and I've noticed, let me see, name of the structure on the ventral side of the heart. When you say structure, are you more referring to an organ or?
Oh, yeah. You know, I was going to kind of talk about that. I'm glad you're bringing it up. That was one. Let me see if I can find it. You know what? The heart is kind of covered up a little bit by the left lung. So there's a little bit of a chunk of the left lung. Hold on, I've lost my mind. There we go. I found it again. Okay, so share screen. Let me pull that up. Okay, sorry about that. That's not the right one. It was this one. Okay, number 19. Yeah. So, I don't know why this is taking so long, but there we go. Okay, ventral side, so it's in front of the heart, more laterally, but still within the axial region. So it's saying that we're still. I this is behind me is green paper, right? Well, you may have just seen my head look and try to point like I'm a meteorologist. I could see anyway. Um, there we go. Okay, left side. Okay, so this is his left side. You see the heart's a little bit left of center. So it's saying in front of the heart and a little more laterally. So what you don't see, I'm going to put my finger right there. That's actually going to be a chunk of the lung that kind of sits over top of the heart. So that's what I would put the lung. So in other words, the heart's like this and the left lung's kind of like this, kind of over top of it. That's what
Oh,
I would go with.
okay, I wasn't sure if you were like referring to that or if you were gonna expect to have like the ribs or the sternum or like something like a ball that's like covering it.
Yeah,
Or like,
that would work too, right? Pericardium, I mean, yeah, ribs, sternum. So yeah, it says name a structure, so I probably could be just about any of those. Um, uh, I've had students put um, they'll try to name like a part of the heart, like left atrium or something. So you don't. So no, yeah, I would go with any of those. Lung for sure, and then certainly ribs or sternum. Pericardium more laterally within the axial region. That's why some of these aren't that terribly specific, and I think that's kind of the idea, is just to get you thinking maybe that they're, you know, just kind of an area and what's in these areas. I think 20 and 21 may be a little tricky too. Structure located toward the dorsal side of the body, lateral and superior to the hamstring. Okay, so we'll read it like, okay, structure located toward the back of the body, lateral, so off to the side, and then above the hamstring. The hamstring's kind of like your back of your upper leg, and then inferior to the heart. So that's a lot of territory, right, between the heart and the hamstring. So, but it's lateral a little bit. So maybe the kidney. That's probably what I would go with. Um, for number 20, structure located toward the dorsal, lateral, above the hamstring, below the heart. So, but there's a lot of other stuff there, right? The you know, both your ascending and descending colons are all over there too. So, so there's definitely more than one answer for these. Number 21, name a structure that's in the medial part of the body, below the lungs, so toward the middle, below the lungs, post and behind the intestines. Probably the diaphragm. I mean, that's below the lungs, and the diaphragm goes way back behind everything and comes up and over. So, but you know, the pancreas is posterior a little bit to the intestines. It's inferior to the lungs. It's on the midline. Heck, maybe even stomach is a little bit behind. So stomach, pancreas, diaphragm. I think all three of those would work for number 21. Usually on the, from what I've noticed the last couple semesters of doing the visible body and using some of their stuff and kind of blending what my stuff and their stuff together, it seems like number 15, 19, 20, 21, and then number 31. those seem to give students the most issues. So, or not, I shouldn't say most issues. There seems to be the most kind of like, there's always a variety of answers, I guess is what I'm trying to say, which is good because it goes to show there aren't a lot of absolutes, right? Once again, in this field. So, and 31 was about the ear. I think I mentioned that one a little bit ago, an injury to the ear. That could be any number of things. Part of this too is just to kind of get you, like exploring, critically thinking, exploring, seeing different terms, seeing just kind of how they're written, and where you're going to locate these answers. Okay, hold on. Somebody else has something. Does that sound good? And again, yep, Hope. Thanks, Hope. Again, put your names in the chat, and I was going to stop recording. I don't think we need to record anymore.